Okay, hi everyone. My name is Cassidy Kotabalavu and I'm a nurse educator here at UHealth and at Huntsman Cancer Institute. And I'm really excited to be here today to talk to you guys about a topic that I am very passionate about, and that is workplace incivility and how that is a crack in our foundation. So first, I think it's important to really define what is workplace incivility. Now, according to the American Nurses Association, it is a deliberate and a harmful behavior that is demonstrated in the workplace by one employee to another. So every day, healthcare workers will potentially deal with incivility, and this is something that really is commonplace in our work. Unfortunately, it can range from social exclusion to rolled eyes to even outright verbal abuse from patients, from their family members, and even from their peers. Now, this behavior really does negatively impact both the work that we do in our environment, but it can also impact the staff's ability to deliver optimal patient care for our patients. During this presentation, you will hear various interchangeable terms, such as workplace incivility, horizontal violence, lateral violence, and even bullying. And I want you to know that they all really mean the same thing. And in general, this is just disruptive or negative behavior that's perpetrated to intimidate someone, to demean them, to undermine, or even exclude other people. Workplace incivility can very well happen between peers, and it can also happen in an up-down or even a down-up fashion. For example, we could see this happening from a manager to an employee, but on the other hand, we could also see it happening from a nurse to a physician. So let's further define what is workplace incivility. There are lots of definitions in the literature that I've looked up, and they may include harassment, discrimination, and even bullying. These actions really can look different in different situations, and they can include things like gossiping, withholding information from a coworker, even passive-aggressive behavior. We might see people start to refuse to do tasks that they've been assigned. We might see uncooperative attitudes, and we might even see someone giving someone else the silent treatment. And an example of that might be not returning a phone call or not returning an email. So how common is this? Does this really happen in the workplace? I found an article from Christy in 2014, and she says that nursing is considered the occupation at highest risk for lateral violence. It's estimated that between 44 and 85% of nurses are actually victims of lateral violence in the workplace. And it's interesting, up to 93% of nurses actually report being a witness to lateral violence in the workplace. While these statistics are relevant and specific to the field of nursing, I think it's important to note that there are comparable numbers really to lots of other places and lots of other fields within the healthcare. So I think we're all somewhat familiar with Maslow's hierarchy of needs, and I like to point this out because I think it's very pertinent. So according to Maslow, we have lots of needs that we need in order to fulfill our highest potential. Individuals really cannot reach their full potential if they're struggling with basic needs such as physiological needs, such as food or water, if they're struggling finding safety in their culture, and if they're struggling with love or belonging. Now, likewise, an organization will also struggle reaching its full potential if incivility is part of its culture. And in today's environment, healthcare organizations really do have potentially unaddressed needs, or what I call cracks in their foundation, which truly undermine staff resilience and they lead to burnout. So in my opinion, workplace incivility really is one of those very deep cracks that needs to be addressed. In order to build a more resilient workforce, we must repair those cracks in the foundation of our workplace. And unfortunately, horizontal violence really is commonplace, like we mentioned a couple slides back. Sometimes our staff members don't feel equipped to take care of these situations on their own, and they don't feel like they have the right education. As a result, they might still feel unsafe in their workplace, and they might not speak up. So in the context of building a home, or in the context of a structure, I want you to think about these questions for a minute that are up on the slide. First, is a cracked foundation strong? And is it able to hold up the organizational structure? Next, can we effectively grow and build on top of a cracked foundation? And last, can we reach our full potential? Now, thinking about this in the context of our workplace environment, can we reach as our full potential as an organization or as an individual if we have a correct foundation that finds civility? So who are the perpetrators? Literature gives us lots of definitions, and it tells us that perpetrators often perceive themselves as either smarter or more skilled. They might feel that they're more strategic than other people. They might have an exaggerated concept of their own self-worth and their own importance. But on the flip side, what's interesting is they might actually have low self-esteem and they might lack confidence. And this promotes incivility, and by promoting incivility, it might be a coping mechanism for them. Perpetrators also seek to dominate other people through controlling behaviors and manipulative behaviors. Now, when looking into this topic, I kept asking myself, what is the real reason that someone promotes incivility in the workplace? Could there be more to this story? Is there another side to this? And in my past experience in healthcare and in the field of nursing, at times I have seen the bullied become the bully. And this seems so backwards to me and a little contradictory, but let's explore this idea for a minute. So there is a theory of the wounded healer that some of you might have already heard, but this is from Conti O'Hare, and it is a way to explain that other side or that flip side to the story. So following an exposure to an adverse event, sometimes our coping strategies are either ineffective or effective. And when we have an exposure and we go down the line of ineffective coping, then the challenge that we faced, that impact is going to be unrecognized. And the associated pain that comes with that really remains unresolved. So this individual will develop problems in social, intimate, and work relationships, and they project their woundedness on both patients and colleagues. They still consider themselves to be unharmed, which is interesting. And in the end, these individuals are less able to empathize with others and less able to cope with their stressors. So they become what is known as the walking wounded. And to me, this is what we refer to as the bullied becoming the bully. Now, these people may experience job dissatisfaction, burnout, compassion fatigue, and even contribute to a negative work environment, and maybe even incivility. And on the other hand, we have individuals that will take their coping strategies and make them effective. Now, the associated pain here with those adverse events that they experienced, they're going to be consciously recognized, and they're transformed into healing. This allows this individual to draw on their woundedness and actually build therapeutic relationships with other people. And the scar remains. That experience will always be there for that individual, but it gives them a greater ability to understand others' pain. And this individual becomes what is known as the wounded healer. They choose to use past experiences to better assist other people that are dealing with that same type of problem. And these wounded healers really contribute to a positive work environment that's full of mentorship and full of support. Now, let's think of this theory in the context of our workplace here in the healthcare field. We might not be able to always avoid experiencing incivility because we saw how commonplace it is. But when we do experience it, we have a choice. We can either become the walking wounded that further contributes to that uncivil culture, or we can become the wounded healer that not only supports other people, but they promote a healthy work environment that's full of civility. The more we support each other and the more we cope with our challenges effectively, the better. So like I said, to summarize, those who survive bullying early in their career, they may carry their learned behaviors forward with them if they're coping ineffectively. But on the other hand, others may decide to cope with their challenges in an effective way and use what they've learned and their experiences for the better. And again, we have a choice. So again, I think it's important to recognize incivility in the workplace, but how do we do that if we don't really know what it is? Bullying is more than just an escalation of personal conflict, right? It could also be an actual attack on personal competence or a professional reputation. So however obvious these things might seem, the perpetrator might also be very subtle and might be very covert. So we have to be very careful in identifying these behaviors so that we can then act on them. Uncivil behavior is often underreported, and it can often be very difficult to identify. Bullies get really good at hiding their negative behaviors and making them discreet. And so therefore, I feel that it's very important to define what counts as bullying so that they can recognize it in the workplace when we see it. Now here's a long list of a lot of different behaviors that can be counted as bullying or incivility. These various behaviors may constitute as harassment or bullying or just plain incivility when seen in the workplace, but it's always important to ask ourselves, is this a pattern? Is what I'm seeing have negative intent behind it? If the intent is negative, then is this behavior a pattern? And if it is, then it's more likely to be workplace incivility. Some of the things on this list I think we see quite often. We might see practical jokes in the workplace. We might see sarcasm and ridicule that can be played off as, oh, I wasn't being serious. It was a joke. But other things that we can see that are a little more obvious are raising one's voice, getting into an argument with a coworker that's unwarranted, or giving someone criticism that's unwarranted, withholding information, and silent treatment. These are a little bit more obvious, but we need to be careful about watching for the not so obvious things. So when we're talking about incivility, there are actual precipitating situations that can be a little bit more at risk for incivility. And certain situations are found in the healthcare field. So being a new graduate or a new hire in a department puts you at risk for incivility, unfortunately. Receiving a promotion or an honor that others feel is unwarranted, that might lead to incivility. Someone that receives special attention from administrators or leaders that other people might perceive as favoritism might lead to this. And also just working under conditions of severe understaffing and stress. Now, literature shows us that the experienced staff member typically is the perpetrator and the novice employee is typically the victim, but it could be the other way around. Being new is not easy, and we are going to make mistakes and ask lots of questions, but questions are good. They're okay. We want them to be asking questions, and that kind of behavior should be encouraged. We really need to promote a culture of psychological safety so that we're not afraid to ask questions and that we can voice our concerns and speak up for others. So I'd like to read a quote from an article that was written by Lara Stokowski back in 2010. And she says, bullying interferes with teamwork, collaboration, and communication, the underpinnings of patient safety. Although to date, research linking bullying to patient safety is often focused on disruptive decision behavior, the principles are clearly and immediately applicable to other healthcare professionals. Intimidation can influence communication in healthcare, and failed communication threatens patient safety. This quote, I think, is very pertinent to this topic. And in the healthcare field, we all have one common purpose, and that is patient first. So we came into this field to take care of other people, to save lives, and we become really great at being compassionate caregivers. We provide very quality patient care. So why would we put ourselves into a situation that's going to lead to patient safety? Why would we put our patients at risk? Why would we treat other people poorly when we know that this is going to lead to an unsafe situation for our patient? We really need to empower each other to collaborate and to work as a team on this. We need to encourage other people to speak up so that when we do see this behavior, it doesn't just impact us, we know that it's going to impact the patient population that we're here to care for. So what's the impact here? Why does this matter? The level of impact is high, and I like to break this down into an individual impact and an institutional impact. So first, individual impact. We might see increased emotional distress in someone. We might see anxiety, depression, sleep disturbances, and even forgetfulness. And we might also see things that stem from compassion fatigue, such as depersonalization, disconnectedness, and even reduced self-esteem. All of these things put the nurse or the healthcare worker or just the non-clinical staff member at greater risk for making mistakes and errors that could impact patient care. Now, on the other hand, what are the impacts of workplace incivility on an institutional level? Over time, we might see lower staff morale, a lower retention rate, and a higher turnover rate. We might also see increased absences, more clinical errors, and even a lower productivity. And in the end, as a result, we might see higher costs being spent and lower patient satisfaction. So let's switch gears here for a minute. Let's talk about strategies for implementing workplace civility. and for filling in the cracks that we find potentially in our foundation. These strategies will help us promote a healthier, safer work environment. And again, when thinking of this idea in the context of a house, I did some research because I'm definitely not a construction worker, but I found that major cracks in the foundation actually indicate a substantial movement and can undermine the home's structural integrity, which makes sense. And therefore, you can't just ignore these cracks in the foundation. You have to fill them in, and you have to be able to stop them where they're at and stop them from spreading, because that's essential to preventing serious structural damage. Similarly, when trying to relate this back to the workplace, and thinking of incivility, we really need to address those negative behaviors that are the cracks in our foundation so that we can promote a culture of safety. So let's first think of strategies that can be implemented on an individual basis. Now, just like an engineer would come into a structure and they would analyze the structure for safety and for cracks in the foundation, they would point out imperfections and they would find the areas that needed to be fixed. They would need to be very aware of these things, just like we need to be very self-aware and control our own emotions when dealing with a perpetrator. Try to stay calm and try not to react initially. Also, try to address the perpetrator promptly and privately when possible, because we know that timing and situation is very important. Always report your event through appropriate channels, such as an RL6 system, through your manager, another different incident reporting system, or even through human resources if needed. Anonymous reporting is usually an option, but still make sure to document any type of uncivil behavior. Next, let's talk about strategies that peers can take when witnessing uncivil behavior. First, you need to intervene quickly. Let the perpetrator know that their actions are not consistent with organizational culture and with institutional policies. We need to always promote a culture of accountability, and we need to stand beside our peers when we see this type of behavior, because it's a slippery slope of negativity. Last, we need to be very self-aware, like I mentioned, and recognize that our own personal actions can either be something that we've taken action on or that we've not taken action on. And they always can relate back to incivility. We must be committed to always taking action and speaking up. Now, I'd like to mention a quick story that I think is important to recognize. There is a bystander effect, and some of you might have heard this story, but this is a phenomenon that was originally realized back in New York City in 1964 when there was a murder of a young woman named Kitty Genovese. And importantly to note, there were 37 bystanders that witnessed this murder. How many do you think called the police? Not one, which is so interesting. Why do you ask? I thought to myself, why would no one call the police? When witnesses were later interviewed, they admitted that they assumed someone else would call. There were so many people around that they figured someone else will take care of it, and they didn't really want to get involved. The lesson here for me is that the greater the number of people who witness a person in need of help, the less likely an observer will take action. So going along the lines of the bystander effect, I think it's important to define what a typical bystander is. And this is someone who sees a potentially harmful situation and really does nothing. They can see the situation happening and not protect the values of safety, trust, and honor, because they might simply think that someone else will take responsibility. And I want to challenge everyone listening today to not be a typical bystander. Instead, we need to be an active and powerful bystander, because we have that ability. The path to intervening really includes, first, noticing the need to intervene, second, interpreting that situation and determining next steps, and third, we need to assume responsibility for ourselves for getting help. Do you need help? Ask yourself that. And if you do, simply call on one other person, and literature actually shows us that other people will follow. We really need to be brave in these situations, and we need to intervene when we witness incivility, because if we accept it, then we teach it. Another peer strategy that I found in the literature for decreasing incivility is promoting a culture of psychological safety. And this is where people are really not afraid of negative consequences when they speak up. An example of this attitude is, my team expects me to speak up, and it's how we do things around here. Here at UHealth, we educate our patients on speaking up when they're first admitted to the hospital. We give the patient a packet of information that says speak up all over it, and we encourage questions, and we encourage their conversation with us. So why not educate each other on this same concept? By speaking up, could we decrease incivility? Could we create a culture of safety? We really need to give each other the permission and the responsibility to ask questions, to voice concerns, and to keep each other safe. So strategies for institutions really are similar to those for the individual and for the peer. Organizations really need to first acknowledge when incivility is occurring. They need to be able to willingly talk about it openly. Leaders really must promote a culture of accountability and a culture of respect, and they need to be a role model of this. Also, surveillance and reporting systems are crucial for monitoring unprofessional behavior. And as an organization, we must uphold our zero tolerance policies for incivility and really stick to them. One interesting article that I found from the advisory board talked about Carrie Gooch of Becker's Hospital Review, who spoke with executives from lots of different hospitals throughout the country, including UCLA and the University of Colorado. And Carrie went around and asked these executives, how are they trying to prevent and respond to incivility in their workplace? And I thought it was interesting because they compiled all of their answers and they came up with the top 5 suggestions. So I thought I'd share those today. We're going to try to relate all of these suggestions to pillars in our workplace that are needed to hold up the structure and also sustain that firm foundation. So number 1, we can prevent bad behavior by modeling good behavior. We must address bad behavior promptly in the workplace by first defining good behavior, including setting expectations on how we treat each other. Here at UHealth, we refer to our promise standards when speaking of behavioral expectations, and lots of organizations have behavioral standards that are similar. These are the gold standard for not only how we treat our patients every single day, but how we should treat each other. And leaders really need to be serving as a role model for this good behavior, because this is not only going to foster that environment that prevents incivility, but it's going to allow your employees to feel safe to speak up. We also need to be good at praising good behavior and not just criticize the bad behavior, because through this, the negative behavior doesn't simply become less noticeable, it actually starts to diminish. Number 2, next we need to really make it easy for the victim to report their experience. Incident reporting systems such as the RL6 system, which is what we use here at UHealth, these allow a victim to report an incident anonymously and really very easily. And this helps individuals come forward when they may not have spoken up otherwise. Having a system in place is so important, and it gives that victim a portal of communication to report that behavior that they're seeing, and this leads to a speak up culture. These systems are meant to assist us not only in reporting, but also learning from our mistakes so that we can find solutions to fix those vulnerabilities that we have in our foundation. And again, this will make our structure even stronger. Number 3, along the same lines of making it easy to report bad behavior, we must also encourage each other to not hesitate in documenting abusive behavior. We really can't take incivility in the workplace lightly, and we know that this is a huge issue and it has such a huge impact on the organizational level. We must confront it head on, and we must know that the significant impacts can have damage on not only our employees, but our patients and our organization as a whole. Number 4, so with that said, I also don't want you to confuse constructive criticism with bullying. There's a fine line, I understand, and not every uncomfortable or difficult conversation that you have in their workplace will qualify as bullying. We encourage people to give and to receive feedback, and it's important to understand the difference between constructive criticism or providing feedback and uncivil behavior, because there is a difference. Sometimes feedback can come off as harsh, and it might not be received well. I know I've been in that situation as well, but I suggest going back to the idea of intent. If good intent is there, it's most likely not bullying. It might have just come off wrong, or it might not have been broadcasted appropriately. And we need to be flexible in our thinking, and we need to allow ourselves to see other people's perspectives and other people's perceptions of different situations. I think when receiving feedback, it's also important for us to take ownership in receiving that feedback, seeing what role we play in the situation, and remembering that when someone gives us feedback, they typically value us and they want to see us grow. They're only giving us feedback to help us. They see potential in us, and we need to remember that. Okay, last, number 5. We need to show victims that we have their back. The best way to ensure that victims feel supported is to have team members and leaders stand by their coworkers when they're experiencing workplace incivility and addressing those behaviors directly. This doesn't have to happen from a manager level. This can be peer-to-peer. We can stand up for each other. This show of support really reinforces that the team is united against incivility. And having that zero tolerance policy stand on incivility is so important. Having an administration that is fully behind taking action in situations that warrants intervention is crucial. And this will lead to a very strong structure. So don't hesitate in speaking out to your area leaders, because I know that they want to hear from you. I'm going to tell you another quick story that, again, some of you might be familiar with. And this is about the Space Shuttle Challenger. The Space Shuttle Challenger disaster occurred back in 1986 in January, when that space shuttle actually broke in the air only 73 seconds into its flight. And this led to the unfortunate deaths of 7 crew members. The shuttle program for NASA actually halted for 32 months after this incident, and an investigation was conducted, of course. And it was found that an O-ring seal in that shuttle's right-sided solid rocket booster had failed at liftoff. And this caused pressurized hot gas to leak, and the shuttle's aerodynamic forces broke. At that time, President Reagan decided to appoint a special commission to further investigate the situation, and what he found is so interesting. They contributed a lot of this incident to NASA's organizational culture and decision-making process, and it was found to be a key factor in the accident. So managers at NASA, when looking back, had known that the structure of the O-ring had flaws, but they failed to address it and they didn't speak up. They also disregarded multiple warnings from engineers on launching on such a cold day in January in order to stay on schedule, because to them that was more important. So the lesson here for me, again, is that when we have concerns and we don't speak up, we contribute equally to the overall result, even when it's disastrous, like this situation. Now, our very own Scott Christensen, a nursing director here at UHealth, he recently published an amazing article this year on escaping from the diffusion of responsibility. And I'd like to refer to some of his content. So I love this concept. I think it's very pertinent to our topic on incivility today. And he talked about Dr. Irving Janis from Yale University back in 1972, and how she popularized the idea of groupthink. And this is when individual responsibility is lost because the overall group has made a decision. Sometimes individuals feel that when the group is supporting a behavior or making a decision, that for some reason they are not individually responsible for the decision or its outcomes. So this occurs when there's sometimes a similarity of group members and you don't have diversity, and no one really wants to rock the boat. And another term for this phenomenon is the diffusion of responsibility. When we don't speak up initially, we are just as guilty when things go wrong. When uncivil behavior occurs, we must speak up, because if we don't, we are just as responsible. We must share responsibility for our organizational culture, and that way we can uphold that firm foundation so that we can reach our full potential. So the overall takeaway here from this lecture is that we have the ability to create and foster a speak-up culture. If the situation doesn't feel right, I want you to say something. I want you to speak up. Don't just go along with the behavior. I want you to protest. I challenge you to not participate in gossip and try to call for help. If we put on our theoretical hard hats and we realize every day when we come to work what we have in our tool belts that we can use to combat incivility in the workplace, we're going to be much better off, and we're going to be able to combat incivility in our own workplace. So let's pause and let's ask ourselves these same questions again. Is a cracked foundation strong, and is it able to uphold the organizational structure? Can we effectively grow, and can we build on top of a cracked foundation? Again, I want to challenge everyone to speak up. I want you to stand up, and I want you to not be silent bystanders when you see this type of behavior, because together we can build a firm foundation and we really can promote